Good morning, everyone. Thank you, AIOC, for the opportunity. So my talk is regarding the role of ophthalmic researchers in the current scenario. So there are few words of truth and reality. I have an academic conflict of interest because I am a professor and my views will reflect my academic standing. I do have a financial conflict of interest as I'm a practicing government surgeon and my views will affect whether or not I get referrals. I have a personal conflict of interest because I work passionately in my profession, so I may be biased. Most importantly, I know that I'm talking to an extraordinarily league of scientists and I need to share something that will improve their opinion of me, so I'm forced to make comments that I know they will wish to hear. So what is happening? The Makkah and the Gita of publication house, Lancet, they are retracting their articles. So what is happening? So what is the purpose that needs to be addressed? It's regarding the uncovering the truth and in the reality, in the real world, and validating it. So truths, they are not equally generalizable and all research is not equally justifiable. So what is the importance of research? It is the relevance of finding the greater issues like the functioning capacity to act and feeling the quality of life. So the researchers, academic centers, guides and funding agencies must consider truthfully whether a proposed study is intended to uncover a relevant truth, function or feeling unbiased. What must not be practiced? It's dedicating time and energy for a pointless or impractical outcome, publication of an unconnected paper, support of a renowned researcher and a prestigious department are just unjustifiable. And in the present system guided by financial gain, power and prestige, most funds are channelized to improve the cataract surgery only and avoiding other important areas like glaucoma and community ocular health. So this is an understatement that a vision for Horizon 2020 clearly states that vision researchers should never forget that beyond careers, publications and funding, there are patients out there who need and expect a better quality of life. So please researchers, once in a while, close your eyes and imagine what impact an eye-opening research has on people affected by blinding diseases and keep working for the good cause. So the role of ophthalmic researchers is far, far beyond imagination to be practiced. So these are the reasonable questions for ophthalmic researchers. What is the purpose of research? Who decides? Who decides that purpose? The investigator, the academic department, the university, the industry, the state, the sick, or the will? So there is a science behind every research. It is sole purpose is to validate. And penultimate aim of science is to provide results for the real world and truth is to be in harmony with the reality. So ophthalmic researchers' goal is to uncover and if possible to understand that external reality. Patient care, in contrast, only deals with relevance, whether the treatment or finding will be of any help in the clinical care. So does validity address an important issue? Is unfortunately least concern with clinicians. And COI, the conflict of interest, is a very important aspect of every research. It is governed by the corrupting power of industry, which provided funding in controlling data, manufacturing needs, and influencing practice patterns all over the globe. A financial gain from industry is always a conflict of interest. Industry is not the only one source of biased, self-benefiting research. Academic institutes fund for what they want, how to control data, manufacture need, and influence practice pattern. That is also prevalence. So the data from the ocular hypertension treatment study was not allowed to be seen by anybody except the investigator. So all these things are happening. And it is very much important while doing all the research that COI are an integral part, so no ocular researcher will survive if they don't honor the COI mandatory for personal survival, nor would industry or universities or even governments. COI are omnipresent and yet not detrimental. So what needs to be the research priority? In accordance to a vision for Horizon 2020, there are 19 priorities in ophthalmic research, like neuron-glia interaction, gene therapy in retinal disease, micro-incision cataract surgery, and flags, along with diabetic retinopathy and ARMD. But issues like improving care and care delivery in the third world countries and ocular healthcare within everyone's reach sounds an absolute anomaly. Old school criticism are always prevalent towards new idea like prevalence of glaucoma in normal IOP range and role of ocular blood flow. The European ophthalmologists at higher position were totally dismissive of this idea that OBF has any role in glaucoma. So the importance of studies and publication with no positive result. So 13% of these studies, they don't have any obvious chance of patient benefit. And studies with reasonable chance of patient benefit, at least someday, is 30%. There might be some chance of patient benefit, 42%. No benefit to the patient, it's 15%. So research for what? Is it for the promotion, for the name and fame, for the sake of mankind, or for the sake of science? I would say science means in servants to the people. So research, it needs to be done in collaboration with the academia, industry, and the availability of research facility. But it is not being governed by the patient. So success of any research has led to literally incredible technological advances such as genotyping and VEGF inhibitors, OCT, and phacoemulsification. So for each ophthalmologist's career, there needs to be a balance between business, or they are taking it as a profession, and for the ophthalmic residents, knowledge of ethics is mandatory, and ethical practice and behavior that needs to be inculcated by their guides, their mentors. So clinical trials are there, they can be surrogate or in which patients are also involved. So the patient concerns are how they feel and what they can do, yet these are almost never been studied. The health research establishment has largely insulated itself from issues that most affect health. Hippocratic oath, used in medical schools as something which the graduating students swear to honor, requires physicians to swear that they will not share their knowledge with anyone other than their brethren. And research beyond cataract and flags, is it just fair to be spending a major portion of research money on the development of instruments that will make things better for those who already are good and ignore those who are in the dire need? So academic freedom and basic aim of research to understand what reality actually is and to benefit living creatures. The brilliance of investigators and the methodology of science need to be merged with the compassion of love to produce valid, powerful, relevant outcomes in the long run. So in summary, without honest research and robust validations in our medical field, science simply going to die. In this era of evidence-based medicine, we have simple retrospective study to complex randomized multicentric clinical trials. Earlier obstacles were there like priority of healthcare, lack of funding and infrastructural support from the institutes, and non-conducive environment that lead to exodus of high-quality ophthalmic scientists and researchers from India, but tides are streaming in positive directions now. The methodologies of science are now being applied not just to those subjects that are relatively easy to study, but to the truly great issue of mankind. And ophthalmic researchers are better guided to make sure that their actions are beneficial, fair, and enhance the ability of each person to care for himself or herself better. Up to 65% of US FDA trials are being outsourced to other countries. So in pre-present and post-COVID era, India is a great choice. More and more accredited and dedicated ophthalmic research labs and facilities are coming up with advanced communique and technique levels. PubMed publication from Indian author are on a manifold rise. The agencies like IEC, ICMR, DBT and DST and NIH and of course, WHO are promoting ocular research in terms of funding and appointments. So definitely there is a silver lining for full-time ophthalmic researchers in vastly growing Indian scientific scenario. These are my references. Thank you. Thank you so very much. Any question?
Thank you, Dr. Arvind, for the beautiful presentation about the research and clinical trials, how to go about it. Any questions from the house? And do you have any comment on this?
No, sir. Good.
Okay, thank you.